Gentlemen, what if the most powerful thing you could do for your oral health, your gum strength, your breath, and even your body's circulatory system was something you were already holding in your hand every single morning? And what if the way you were using it was leaving nearly all of that potential completely untapped? If you've been brushing your teeth for 50 or 60 years and assuming that's enough, stay with me. Because what I'm about to share isn't just about cleaner teeth. It's about a technique that reaches into your gum tissue, your jaw circulation, and your body's systemic inflammatory response in ways that your regular brushing has never been able to touch. And once you learn this, you will feel the difference the very first time you try it. I'm Dr. Narita, a physician with over a decade of experience working with men in the 50-plus demographic on the intersection of oral health, cardiovascular wellness, and whole body vitality. Most people don't realize how deeply connected the mouth is to the rest of the body. In my years of practice, I've sat across from thousands of men who came in about one thing and discovered that the answer lived somewhere they never expected. The mouth is one of those places. And what I'm about to share with you today is something I genuinely wish every man over 50 was doing every single morning. Before we go any further, do me a favor. Hit that like button and drop a comment telling me where you're watching from today. I love connecting with men from all over the world who are taking their health seriously. It means more than you know. Now, here's what most men over 50 don't realize about their oral health. It's not declining because they stopped caring. It's declining because the basic technique most of us learned as children was never designed for the specific challenges that come with aging. Gum tissue thins and recedes as we get older. The jawbone loses density. Saliva production decreases, which removes a critical natural defense against bacteria. Inflammation, which is at the root of conditions ranging from gum disease to heart disease to erectile dysfunction, finds a powerful entry point in the mouth. Researchers at Harvard Medical School and at the European Federation of Periodontology have both published findings linking periodontal inflammation to systemic cardiovascular risk. The mouth and the heart are having a constant conversation. And for most men over 50, that conversation has been quietly working against them. Here's the analogy I use with my patients. Imagine your gum line as a garden wall. When it's maintained properly, it holds everything in, keeps infection out, and supports the structure beneath it. When it's allowed to weaken, cracks form. Bacteria move in through those cracks, and from there, they don't stay in the garden. They get into the water supply. They circulate. That circulation is not metaphorical. The oral bacteria associated with gum disease have been found in arterial plaque. This is not dentistry. This is whole body medicine. And the technique I'm going to share with you today addresses all of it. Let's count through the 5 elements of what I call the complete oral restoration technique. Each one is simple. Each one takes only seconds to add to what you're already doing. And together, they transform a routine you've had for 60 years into something genuinely therapeutic. The first element is what I call the angle reset. Biologically, most men brush with their toothbrush held perpendicular to the tooth surface, moving back and forth in a horizontal scrubbing motion. This approach cleans the visible surface of the tooth reasonably well, but it completely misses the sulcus, which is the small groove where your gum meets the tooth. That sulcus is where periodontal bacteria colonize. It's where plaque hardens into tartar. It's where the early damage of gum recession begins. Dentists and periodontists call the correct approach the Bass technique, named after Dr. Charles C. Bass, who developed it in the 1950s specifically to address subgingival cleaning. You angle the bristles at 45 degrees toward the gum line, so the tips of the bristles slide gently beneath the gum edge and sweep the sulcus clean with small circular motions rather than long horizontal strokes. Emotionally, this matters more than it sounds. Many men in their 60s and 70s come to me carrying quiet shame about their gum health. Sensitivity, bleeding when they brush, gums that seem to be pulling away from the teeth. They feel like they failed at something basic. I want to say clearly, you are not broken. The technique was simply never taught correctly. When you reset the angle and begin reaching the tissue that actually needs cleaning, that bleeding typically resolves within 2 weeks. The sensitivity begins to ease. And with it comes something I've watched happen dozens of times: a quiet restoration of confidence. Practically, here's what you do. When you brush, tilt your toothbrush so the bristles point toward your gums at roughly a 45-degree angle. Use small, gentle circular strokes rather than horizontal scrubbing. Apply light pressure only. The bristles do the work when the angle is right. You don't need force. Spend approximately 30 seconds on each quadrant of the mouth. 2 minutes total, 4 quadrants, light pressure, 45 degrees. That is the angle reset. The second element is the tongue pressure point. Biologically, the tongue is the most muscular organ in the mouth, and it is in constant contact with the teeth and gum tissue from the inside. Most men never brush the inner surfaces of their lower front teeth thoroughly because the tongue gets in the way. But those inner surfaces harbor significant bacterial accumulation, particularly in men over 50 whose saliva flow has decreased. Less saliva means less natural antimicrobial rinsing, which means bacteria on the inner tooth surfaces have more time to establish. Additionally, the tongue itself is one of the primary sources of the volatile sulfur compounds responsible for chronic bad breath, and most men brush only the front portion of the tongue if they brush it at all. Emotionally, breath is deeply connected to social confidence. I remember a patient, Robert, 67, a retired engineer who came in not for a dental concern, but because his wife had gently mentioned that his breath had changed over the past few years. He told me he had tried every mouthwash, every mint, every spray on the market. Nothing lasted more than 20 minutes. He described feeling self-conscious in ways he never had before in his life. The problem wasn't his teeth. It was the bacterial load on the posterior portion of his tongue, combined with the inner tooth surfaces he had never been reaching. 4 weeks after learning the tongue pressure point technique, Robert came back and said his wife had noticed within the first week. That quiet validation meant everything to him. Practically, after you finish brushing your teeth, hold your brush flat and use the bristles to brush the full surface of your tongue, moving from the back toward the front. Go as far back as is comfortable, 3 or 4 strokes. Then, turn the brush vertically and use the tip to reach the inner surfaces of your lower front teeth in a sweeping upward motion. This takes less than 30 additional seconds and addresses 2 of the most neglected surfaces in the entire mouth. The third element is the hydration prime. Biologically, saliva is your mouth's most sophisticated defense system. It contains antimicrobial enzymes, including lysozyme and lactoferrin, that actively kill oral bacteria. It buffers the pH of the mouth, protecting against the acid produced by bacterial fermentation that erodes enamel. It remineralizes early enamel lesions, and its flow is dramatically reduced in men over 50, particularly in those taking common medications, including antihistamines, antihypertensives, diuretics, and antidepressants. Research published in the Journal of the American Dental Association has shown that medication-induced dry mouth significantly accelerates both decay and periodontal disease in older adults. When you brush a dry mouth, you're cleaning in conditions that are already compromised. Emotionally, dry mouth is one of those symptoms men tend to tolerate quietly. It feels like an inconvenience, not a medical issue. But I've watched it quietly erode the confidence of men who begin noticing their teeth changing, their breath changing, their comfort during meals changing. When you address it directly, when you create the conditions for your mouth to do its job, things stabilize. The mouth begins to feel like something working for you again, rather than against you. Practically, the hydration prime is this: drink a full glass of water 5 minutes before brushing, and add 1 small pinch of non-iodized sea salt to that water. The salt helps stimulate minor salivary glands and begins the antibacterial process before the brush even enters your mouth. Then, after brushing, rinse with plain water rather than mouthwash first. Commercial mouthwash containing alcohol is a powerful desiccant. It kills bacteria effectively, but it also strips the salivary film and dries the tissue. If you use mouthwash, use it 30 minutes after brushing, not immediately after. The fourth element is the gum activation pass. Biologically, gum tissue is vascular. It contains a dense network of small blood vessels that rely on stimulation to maintain their tone and circulation. When gum tissue is never directly stimulated, circulation in the tissue becomes sluggish. This impairs the delivery of immune cells to the area, reduces the tissue's ability to repair itself, and contributes to the gradual recession that so many men over 50 experience. Periodontists have long used rubber-tip stimulators for this purpose, but very few men know that a gentle technique with a soft toothbrush can achieve a meaningful portion of the same circulatory benefit. Emotionally, gum recession is one of the most visually distressing changes men notice in their mouths as they age. The phrase, "teeth look longer," is one I hear often, said quietly, as though they're describing something they can't stop. The gum activation pass doesn't reverse existing recession, and I want to be honest about that. But it can meaningfully slow its progression by restoring circulatory health to tissue that has been chronically understimulated. And for men who have watched changes they felt powerless to address, even that shift from passive decline to active maintenance carries real psychological weight. Practically, after completing your regular brushing, hold the brush with very light grip and use the tips of the bristles in a gentle, pulsing circular motion directly on the gum tissue itself, not the teeth. Work around the entire arch, upper and lower, spending about 5 seconds per section. You are not scrubbing, you are stimulating. Think of it the way you might think of a gentle massage compared to a hard rub. The goal is increased blood flow to the tissue, not mechanical cleaning. This adds approximately 45 seconds to your routine and, done consistently, produces noticeable changes in gum tone and color within 3 to 4 weeks. If you're finding value in this, take a moment to hit that subscribe button. I share new health insights for men over 50 every single week, and I don't want you to miss what's coming next. The fifth element is what I call the oil seal. Biologically, oil pulling is an ancient Ayurvedic practice that has been subjected to increasing scientific scrutiny over the past 2 decades, with generally promising results for oral bacterial reduction. A study published in the Journal of Ayurveda and Integrative Medicine found that sesame oil pulling reduced Streptococcus mutans counts in the mouth comparably to chlorhexidine mouthwash. The mechanism is mechanical and chemical. Oil is a fat-based medium, and many oral bacteria have lipid-based outer membranes. When you swish oil through the teeth and gum tissue, it physically captures bacteria and pulls them out of the sulcular areas between tooth and gum. For men over 50, where gum sulci are often deeper due to some degree of existing recession, this capillary action reaches places that water-based rinses simply cannot. Emotionally, I understand that this one sounds unusual when you hear it for the first time. I've seen the skeptical look on patients' faces. I had it on my own face the first time I read the research. But here's what I tell every man who looks at me that way. You don't have to believe it. Just try it for 2 weeks and let your mouth tell you whether something has changed. I remember Edward, 71, a quiet, practical man who described himself as someone who didn't believe in alternative anything. He came in for a routine visit and mentioned that his gums had been inflamed for years despite doing everything right. I suggested coconut oil pulling, 3 minutes, 3 times a week. He came back 2 months later and said he hadn't told his wife what he was doing. She had simply looked at him one morning and said, "Your gums look different." He said that was all the evidence he needed. Practically, use 1 tablespoon of organic coconut oil or sesame oil. Put it in your mouth and swish it gently through your teeth for 3 to 5 minutes. You do not need to do this aggressively. Let the oil work. Spit it into a trash can, not the sink, as oil can clog drains over time. Rinse with warm water. Do this 3 mornings per week before brushing, not after. Before breakfast, before coffee, before anything else enters the mouth. 3 to 5 minutes is enough. You do not need to do the 20-minute sessions sometimes recommended in popular wellness culture. The meaningful bacterial reduction happens in the first few minutes. So here is your simple action plan. 5 minutes before brushing, drink a full glass of water with a small pinch of sea salt. Begin brushing with the angle reset, bristles at 45 degrees, small circular motions at the gum line, light pressure, 30 seconds per quadrant. Add the tongue pressure point, brushing the full tongue surface and the inner lower front teeth. Follow with the gum activation pass, gentle pulsing circles on the gum tissue itself. 3 mornings per week. Before all of this, do the oil seal with 1 tablespoon of coconut or sesame oil for 3 to 5 minutes. That is the complete protocol. 5 elements. The first 4 happen every morning and add less than 3 minutes to your existing routine. The 5th happens 3 times per week and adds 5 minutes on those mornings. 2 weeks from today, you will notice something has changed. Your gums will feel different. The sensitivity that many men have simply accepted as part of aging will begin to ease. Your breath will shift in a way that others may notice before you do. And beneath all of that, something quieter. The knowledge that you are doing something genuinely therapeutic for a system in your body that connects directly to your cardiovascular health, your inflammation levels, and your overall vitality. I want to say something important to every man who made it this far. If you've been quietly frustrated by changes in your mouth, your breath, your gum health, if you felt embarrassed or resigned, you are not broken. Your body is not failing you. It has simply been doing the best it can with a technique it was taught 6 decades ago and never updated. What's happening is not a verdict. It's a starting point. And starting points, no matter when they arrive, are always worth taking. Even after 60, 65, 70, your tissue can respond. Your circulation can improve. Your body has a remarkable capacity to stabilize and restore when you give it the right conditions. It is never too late to begin. If this video gave you something useful today, give it a like so other men can find it. Drop a comment below telling me which of these 5 elements surprised you most. Share this with a brother, a friend, a neighbor who might need to hear this. And subscribe so you never miss the health insights I share here every week for men over 50. You might be the reason another man takes his first step toward feeling genuinely well again. I'm Dr. Narita, reminding you that after 50, your vitality is not behind you. It is simply waiting for you to reach for it with intention. Take care of yourself, gentlemen. I'll see you in the next one.